Welcome, everybody. Hello. This webinar is Collaborative Therapeutic Assessments to Better Understand Yourself or Your Child with Dr. Lisa Nakamura. Lisa is a licensed psychologist at Summit Center. She's been with us for about 6 years now. And take it away, Dr. Nakamura.
Great. People can call me Lisa here too. So I just want to say I truly love assessments. I had the opportunity to learn this collaborative therapeutic assessment from Drs. Caroline Purvis and Dr. Stephen Finn, who I'll talk a little bit about later. And when I was working for West Coast Children's Clinic in Oakland, which is a clinic that serves children, youth, and young adults who are on Medi-Cal and foster care children as well. And I have loved this model that I've tried. I'm going to be talking about how I've adapted it to Summit Center. And I'm not the only one who's been trained in this model. So there's others of us who at Summit Center who also have been trained as well. So I'm excited to tell you about it. Before we begin, some of you may have experienced assessments, while others might be completely new to this process. So I wanted to just start with, well, what are assessments? Assessments really aim to identify educational and/or social-emotional needs and to make recommendations. This may involve a diagnosis. Oh, I'm sorry. Elizabeth, can you go to the next slide? Sorry about that. And this can be done through interviews, completing forms, and/or testing measures. Assessments come in different forms. Assessments can be done at medical settings, where they're trying to look for criteria to meet a diagnosis, a medically related diagnosis. So this would not include learning issues, except for ADHD. That's the only one that they will consider as both medically related. Assessments also take place in school districts that are meant purely to determine whether a student is eligible for special education and to set goals related to that. Assessments in private practice settings can include educational therapists, learning specialists, learning centers, and psychologists, and they can vary. Assessments done by educational therapists and learning specialists generally have a master's level degree, and so they can't give a diagnosis. But they can provide really important information. So for example, an educational therapist or learning specialist may be working on reading remediation, and then they do a pre and post evaluation around reading and a reading assessment just to see where they're at, if there's any areas to still work on. And so it helps hone in where to target their efforts in terms of remediation, and it can be incredibly valuable. Because psychologists can give a diagnosis, then they're able to also give recommendations and that could be thinking about accommodations for students as well. So that's the other piece around that. I'm going to give you like an example, though, of how it can look very different depending on the setting. And these are broad brushstrokes. I can say that they may not apply completely to everyone working in these different models. But for example, an ADHD assessment in a medical setting, what I've typically have seen is that they'll have an interview and they'll have people complete forms. So self-report forms, or if it's a child, parent and teacher forms. And then based on that, they'll determine whether there's an ADHD diagnosis. In the school districts, it can vary. It could also be exactly that same model. So there's some school psychologists that will also include some testing measures. Maybe like 1 or 2 at most. And then in assessments in a private practice setting, they'll include a testing measure that, like in our setting, for example, will include a battery of attention testing, but it will talk about it in a way that gives a whole attention profile. So for example, little Johnny might have a really hard time with auditory attention, but he does a lot better with visual attention. So that's really important, because in a school, then we want to make a recommendation of making sure that visual aids are included when there's verbal instructions. So that's just gives you kind of the broad brushstrokes of what assessments can look like in various settings. Okay. Okay, so what then is a collaborative therapeutic assessment? Oh, thank you, Elizabeth. So collaborative therapeutic assessments were developed this by Dr. Constance Fisher, Leonard Handler, Caroline Purvis, and Dr. Stephen Finn. And I'm going to be talking about some aspects of Stephen Finn's model that I try to incorporate at Summit Center. Now, Dr. Finn's model has, if taken to the full extent, we aren't able to do at Summit Center. There's like a live, for example, a child would get assessed in one room, and then there's a live feed to another room where caregivers or parents are there with another psychologist, making their own observations of their child, so that we can understand how it is from their perspectives, but also notice what else is coming up for them, and see if we can get closer and closer to the same page around what the testing is showing, what they're noticing, and how we can knit that together. So that's another part. It's almost like there's a family kind of therapy version that's coming in to the assessment. And we don't have that capacity, but I'm going to tell you about the other ways that it can be incorporated. And so I think one thing I want to recognize is that many psychologists are collaborative and therapeutic by nature. So it's not that there's it has to come from this model. They just naturally kind of incorporate that, and that's really important. And then there's just what I would say with the people who developed the CTA model is that there's an intentionality behind it, and thoughtful at different aspects, at each level of the both at the initial consultation and throughout the assessment process with either a child, a youth, or adult, to have some intentionality in it. Okay, and so it can vary per individual. It can mean that I share something about test findings that resonate and helps put the family on the same page, and that also makes recommendations make sense for everyone. It could be acknowledgement that how one is neurodiverse or twice exceptional, meaning that you have skills on both ends of the bell curve. So really important strengths, but also really important challenges to identify, and how that can mask their issues. And it's sometimes really important to just, through the process, for some people, acknowledging the level of challenge is really validating. And so that's sometimes it could be an important way to uncover something that we didn't predict would be an issue, but it was actually through the process we discovered there's something more to this picture, and it's important for us to highlight and look together. Okay, so Elizabeth, can you go to the next slide, please? Great, thank you. So what can a CTA assessment look like at Summit Center? So sometimes I start with, especially youth coming in, and they have never done an assessment before. And I'm highlighting youth because many adults might self-refer themselves. So then the youth is like, I don't know why I'm here. Or like, well, actually, this is an opportunity for you to learn about yourself, either through your learning style, or if it's relevant, your emotions, like your emotional processing. So do you have any questions for yourself? Well, many youth will reply, nope, I don't, nope, nothing. This I actually got from West Coast Children's Clinic. I would hand them a list. I kind of adapted it for Summit Center. I'd had them a list that other youth have asked themselves as part of the assessment. And there's a really good portion who then go check, 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 check. And then so I look at it together with them, and it becomes this really important springboard to conduct a clinical interview, but that's relevant to them. Okay, so you're having trouble sleeping. Tell me about that. Like, what's happening to you at night? Like, what keeps you up at night? Is it thoughts? Is it screen time? Like, what is it? And what's really hard about that for you? So things like that could happen. If they're open, I'd like to try to enlist individuals as a co-pilot while we go through the testing. Like, what did you like about that task? What was your strategy? What made it hard? Does this remind you about when it was hard for you in school? Well, yes, it was. It's like this is just like in school. And so what's that like? That must be so difficult, right? Okay, well, especially when there's a youth who are like, well, I don't know why I'm here. Like, okay, this is why I'm here, because I'm trying to figure out what could help you with that. Okay, discuss. Sometimes I like to try with each client to discuss their strengths and potentially, if they're ready for it, any areas of challenge as we go through the testing. I never, it's just to say like, oh, I noticed that was hard. Did you notice that too? Or was it just me? But I like to actually, as we go and I get some scores back, I like to say, you know what, you did so well on this. It can be really, really helpful. Because then they could feel a little bit like it's not, this testing is not just me trying to put eyes on what's quote unquote wrong with them, but we're just trying to learn about them in a holistic manner. Okay, sometimes I like to hear their observations about themselves in the testing and then integrate that into the report. There's this lovely neuropsychologist in our area who's Dr. Teresa Doyle, who I used to work with, and she would talk about these exemplars that she would use. And sometimes with some of the youth, that they would be so thoughtful about describing, let's say, their attention issues, that it's just a lovely sort of way for us to kind of like highlight that in the report, because it kind of breathes life into a score. Assessments at their best are both science and art. And so it's like trying to like also figure out and bring out like the things that they're noticing. So I can have like a child who, I'm giving ADHD because I feel like it's an easy one, but it applies for every other condition that could happen. But I could give a child like a child may look as if they're typical in terms of their attention, but qualitatively, I'm seeing and they're seeing and their parents are seeing that they're working so hard to compensate, and they're double checking and they're triple checking, and that's like the best they could do is they could reach themselves into this typical range, but it has a cost. And then I get concerned about like, well, what implications does this have for them for high school and college if it's really hard now and beyond? So that's really important. It's important to just hear their thoughts. and enlisted them. Feedback sessions can also be therapeutic. Sometimes I'll have like, I like to kind of like talk with parents about, or an adult client about what kind of, how should we do the feedback? So should we have like separate parent and child feedback sessions? Should we have them together? You know, if there's a therapist involved, would it be important to have them involved in that way? So that can be another form. And Dr. Finn's model has like, also incorporates, and I've used on occasion, a letter for youth. Usually it's a youth in this case, because it helps answer any questions they have. So rather than actually looking directly, you know, sometimes it's not appropriate necessarily to share a clinical report to a young person, but they also want to know what happened, right? Like what are the findings? And if they generated questions at the beginning, then I like to meet with them so that I could answer those questions directly. And then I have a letter that sort of summarizes that piece, highlighting their strengths, talking about what might have puzzled them, and then directly answering the questions so that they have something direct to kind of leave with in that process. And then sometimes, this is very rare and infrequent, I'll have a family session. And in those moments, I will, I have, it only has to make sense. It's like a targeted family session. And it's not typical because it depends on the readiness and supports that are involved with the family. But there can be really important things that get communicated. So usually there's a discrete goal of something that needs to be communicated and an assessment of readiness. So so maybe there's something that needs to be communicated, and then it's important and it's possible because maybe there's a therapist that also could be at the session to be a connective tissue to after this session is done that they can continue working with the family. Or it could be that there's a lot of readiness in all members and it just needs to be brought out and talked about together. So I've had that session happen, those kinds of sessions happen, but they are rare. Okay. So maybe I'll just pause and ask if anyone has any questions, but I could also go on too.
If anyone has questions, you can type them into the chat. And we only request that you don't include any like personally identifying information. We want to, you know, don't tell us the name of your child or that kind of thing. But it's not, I'm not seeing any right now.
Yeah, that's okay. So what I'll do is I'll move on. If we could go to the next slide. So who is appropriate for this approach? I think that we can all, as clinicians, be more collaborative and therapeutic in testing for everyone, even those who may be averse to the process. Many youth and adults are quite open, interested, and curious about their learning style or social processing or emotional functioning. They're quite well suited for this approach. Some may want to know this as they enter their next developmental stage, like high school or college. Adults may want to learn about themselves for graduate school, career planning, or job searching. And you know, one of the things I find really wonderful about the younger generation is that many of them value mental health and well-being. And some of them are quite active about looking for potential diagnoses that could name what challenges they are facing, they feel like they're facing. And so some might come in and then they might say, I think I have this, or this, you know, and then we could kind of unpack that together. Like okay, you're thinking that you have this, but what does that look like for you? Just so that I understand what that, how that is, how that relates to you as a person, versus this certain like diagnostic criteria. Okay. And then, so what about children and youth who may feel resistant or defensive about testing? Can you still be collaborative or therapeutic? Yes. It's possible, and it has happened. And I think, like, and I say I'm focusing on children and youth in this respect, because adults who self-refer, they often want to just come in, and they are part of that process from the get-go. But it's not all the time. So for some children, youth and adults, though, I will acknowledge that some want to just come in and come out, and just to complete testing. They just want to manage it that way. And, and I respect that. There's no forcing of a collaborative interaction around that. So we have to always respect wherever a person starts. And then if there are openings, like they might notice something, like a child might say, like, reading is hard, and then we could kind of notice that together and talk about it, so that we can see what else can come from that as well. And so sometimes it could lead to like a more of an opening over time, so that the process becomes more collaborative. And then that can kind of relate to, sometimes the nice thing about that is that then you'll get sometimes more buy-in about the results, and it doesn't feel like it's just coming from thin air. So the other thing I wanted to talk to you about that was, oh wait, let me just make sure. Like sometimes some youth will actually tell me, let me give you another example. Some youth might actually tell me like how they don't want to do some certain things. Like they don't want me to contact their teacher and send them forms to complete for an assessment, for example. And I, would like to step back, like, if it's a teen or a young adult or youth, and just gently explore, like, what are they concerned about in that, and then can we talk about it together, and not be so invested in the results, but talk about it as a way to figure out what might be behind that. So that's just like an example of like, if there's blockage in that way, that it's not just taking the blockage at face value, but that there might be something underlying that, and maybe we could talk about that piece, because that's really important. Sometimes I might have a child that really does show some resistance for testing at times, but also this is happening at home or at school or both. And so then it's important for me to figure out, like, it's not just these results that I'm getting, but like, what can I do, and what can I try to see what might be helpful to get the child more open to tolerating that feeling of not wanting to do it and to be engaged, because that's the same kind of parallel process that's happening. And if I stumble on something, then let's talk about it. So I'll use all these different tools, what's like soothing sensory, like what might be a sensory object that's soothing, what might be help them regulate, things like that. And then see if we could bottle that and talk about it in the recommendations. And, if there's nothing that we can find, that's actually significant. So we got to talk about that too, right? In a different way. Okay, one thing, or what are some potential barriers in a collaborative therapeutic assessment? I'll say that it is harder to have this model if the sessions are really infrequent and spread out over a long period of time. It's just hard to feel like I could really develop a relationship with the person. So that's it feels like we might be starting almost from scratch each time. So I just want to talk about that it can be harder. And um, sometimes there's a real need. We're like on a strict timeline, and we're on a strict timeline, and or scheduling is very hard and needs to be completed, or the idea of having an extra session would be too much. Then I have to really make sure that I prioritize the testing. It doesn't mean that I don't have occasional conversations, but that would be the main priority. So that can be another aspect of it. Okay. And feel free to let me know if you have any questions as I go through this. Elizabeth, can we go to the next slide?
Yes, I was wondering how many sessions are often involved in something like this.
Oh, it's generally, I would say, not that many, like it's not an extra session per se, I would say. Like it's sort of like I would sort of incorporate it as I'm transitioning between tests, or I would talk about it in the beginning of a session, like some initial thoughts I have, which might take like as little as 5 minutes but or longer. So it could vary per child. And so if I feel like there's like a child or youth or adult who would love to have the spaciousness to explore this, then I also want to be upfront with the parents to see if that is workable to them, so that we can involve that. So I mean, it really ranges, is what I'll say, is that it doesn't necessarily add a lot to the estimated time that I might put out. But if I feel like if I'm anticipating that it might, then I'll let the parents know so that they're aware of the potential time and potential added cost around that, especially if it's significant, so that they have a choice in that before we even go into it, if that makes sense.
Okay. Thank you.
Yeah.
Right here. This is the correct slide.
Okay, great.
Okay.
So what are the benefits? The benefits is that there's clarity, that there's sometimes there can be greater understanding from both the youth or adult, as we go through the process, so that by the time that we get to the end, that there's a good portion that's already known about the findings, so they're not a surprise, and then that we're on the same page. Um, and so let's see. So sometimes, like as it could be a dynamic assessment, so that like say a youth is having a lot of anxiety at school, but actually, there might be what hadn't been considered as part of the assessment process was social processing, but they're kind of highlighting that in as part of their assessment, as we're talking to one another. And so then we have to look at that, and it turns out that that was a really big part, a missing link that was important for us to highlight. So then that dynamicism that can happen, and I don't think this is necessarily unique to a collaborative therapeutic assessment. This is something that many of us do, but I think it's really, really important in the way we do it. And one of the things that come out of research around collaborative therapeutic assessments is that like the family is more on board with the recommendations, because we've kind of talked about why this leads to this, and so sometimes I've had this lovely experience where I'm at the feedback session for a youth, and they've come up. Now they feel quite empowered by understanding their learning style. And now they have some ideas about recommendations of what could help them at school. And they're so great about it that then I was like, oh my gosh, that's great. Let's now put that into the report. And then I'll forward that to the parents so that it sort of represents themselves, but it gives us a sense of empowerment and starts them on that journey for self-advocacy for their learning style. Okay. So I think, okay, so yes, I think that's the other piece. So let's go into the next slide. Okay, so there can it can I kind of touched on this with Elizabeth's question, but are there additional costs associated with a collaborative therapeutic assessment? It really depends. For many cases, I actually briefly integrate some feedback about the findings and a person's observations as part of the process, and this process does not add so much time or cost to the overall assessment. And then again, if there's a situation where there's someone who's really invested in understanding and they want to use the time to explore this, then I will then go back and I'll talk about the estimated potential fees of that so that they're clear on that, or if it's parents involved, that they're clear on that as well before moving forward. Um, and Yeah, and then if like, for example, if I'm doing a letter for youth, then I'll also talk to the parents about that potential additional fee that's associated with that as well. Um, okay, so um, so uh, so I think that's so I will so we could go to the next slide. Okay, great. So I just want to say thank you. My contact information is below. Feel free to reach out to me, but I'm just wondering if you have any questions.
Okay, so while if anyone has a question for Dr. Nakamura, it's a great opportunity to, hear from her directly. And to kind of kick us off, I had a question, and I was wondering if this kind of assessment, does it ever like flow into therapy? Do you take people on as therapy clients, or would you share results with a therapist? I don't know if
Yeah, um, I know that that's been explored in the past, but I have not done that at Summit Center at least, but it has been done elsewhere. But I have I generally like will refer a family or an adult to a therapist. And if there's already one involved, it's great that to have their involvement in the beginning and throughout and at the end for sure. So I'll meet with them as well.
okay. A question has come in. What happens if it appears that medication should be tried, such as for ADHD?
Oh, that's a great question. I think usually if I'm looking at an ADHD assessment and we do an initial consultation, I'll ask parents, especially or an adult, like what is their own kind of feelings about medication, because I kind of want to know what what they're thinking about in terms of what's the fit for them and their philosophy around it. Some parents are open to medications or adults, and some are absolutely not. And there's a lot of people in between. And so if I'm going to make a recommendation, I want to be sort of mindful of that. Um, and so that's one thing I'll talk about. But I also often share with some parents that even though I understand that they are not in, interested in medication, there are some cases in which there might be like such a significant level of ADHD that is really quite debilitating that I might say it's something to consider, and that they could check out if they're open. And here are some people who might fit within their style and concerns and talk about their concerns. So I've done it that way. I hope that answers your question, but let me know if it didn't.
Another question. What would you find out more or what new benefits, if you already have a diagnosis of ADHD from a few years back when a child was preteen
Mm.
versus now that they're an older teen or in the teen years.
Yeah, it's amazing. Someone's ADHD profile. I mean, I've been in this field for long enough as my colleagues that we get some lovely repeat clients that come back and return, and I get to see, how their ADHD profiles have changed over time, often for the better. And so it's really important acknowledgement about where they're at, and because the brain is plastic and it's still developing, especially from a child to a teen. So I think it can be really helpful to know where they're at, because they have a sense of themselves, but it could also be helpful just to see where they're at for their whatever next stage that they're anticipating in.
Mm-hmm. Okay, thank you. Feel free to, reply back if that doesn't fully answer your question. The next one was, can CTA be done online? I think they mean like remotely, or does it have to be in person?
Oh, that's a really good question. I mean, I think that, first of all, there's just some barriers about doing assessments in general, like uh, online. It can be we definitely did it during the pandemic within the state and sometimes across states, but the across states are harder. But I would say that if you want to, I think that it can still happen, because we'll still have the dialogue, especially if you're like an adult, and we could talk about it online. So I think that there can still be a collaborative therapeutic piece online, just as there is with therapy online, right? So I do think that that's quite possible. The one thing that will be harder to do, and that's just harder to like witness in person, though we have like ways to manage it. So because for online testing, we'll have like another camera that looks at like a response booklet and what's happening in real time, right? While we're doing a test. But it's much easier if I'm actually in person, because then I could see like the whole picture, like maybe they're jiggling their leg a lot, and that's like really important. Maybe one of their hands are shaking on the side, and I didn't never notice that before. Like, it's just, there's like some things that might be out of view that could be still like just important to note, but I still don't think that that means that we can't be therapeutic.
Great, thank you for answering that one. Next, does that mean Summit prescribes or refers to someone else for even more evaluations? Well, that's
Um,
true for
for let's see, I'm not sure what the nature of the question is, but we if we're doing an assessment, we're going to be assessing for the exact nature of that, the scope, whether it be like for emotions or for other things. But
they say, referring to the above question, read meds.
regarding
But
med,
this is specifically about what happens if it appears medication should be tried, such as for ADHD. Does that mean you would prescribe or refer to someone else?
oh yes, we would definitely
Yeah.
thank you for the clarification. We would definitely prescribe, we do not as psychologists have the ability to prescribe meds, so we would refer to someone else to do that. But what's nice is that then they don't have to go through an evaluation. They could just simply give them the report, and like a psychiatrist, for example, or a pediatrician, and then they can take it from there for medications.
Yes. Okay. Thank you. And then the latest question, does Summit Center currently offer assessments for out-of-state clients, such as Nevada? And I think I can answer that one a little bit. One of our psychologists is licensed in Nevada, and she will see clients either at her office in Southern California or remotely.
Mhm.
So anything to add to that?
Yeah, and I believe she also just got licensed in Washington and Oregon. So now that's
Washington for sure. Yes.
yeah, or Washington, sorry,
Yeah.
Washington. So that's also another possibility.
Yeah. Okay. Does anyone have anything else that they'd like to know about our services, about collaborative therapeutic assessments, or anything else? Okay, I think we might wrap it up then. Thank you so much, Lisa, for your time. And oh yes, we've got Dr. Peters replying here, Washington and Nevada. So yeah, thank you, Dr. Nakamura. Thank you everybody for joining us. We are recording this. I'm gonna stop that now. So the recording will be available later. And I think that's it. Everybody have a good rest of your day.